I actually have another bill in that deals with cultural competence training for physicians and other allied health professionals. It's because of the influence of the Bronx Health Reach. Because you've heard Dr. Kalman, you heard Dr. Rivera talk about the attitudes of the doctors, of the physician, how they regard us, how they regard the patients, their view of people who speak a different language, their view that many of us may not understand medical jargon. Well, unless they're told during their medical training to examine their attitudes, they're not going to do that. They're not going to recognize that they may have prejudices or they may have discriminatory thoughts and way of dealing with different patients of different colors, different ethnicities, different languages, different religions. So I had a bill in since 2004, it's A2112, for cultural training and competence training for every physician, every healthcare professional. And we require every 2 years you get training in the non-discriminatory practice of healthcare. You then will be trained and learn about yourself and what you have to do under the law in enforcing the civil rights law, make sure people do not get discriminated against. The second bill I'm introducing this year has to do with the Patient Bill of Rights. We know it exists for the hospital patients, inpatients, and the hospital clinics, but not for the outpatient clinics that are run by what we call the faculty practices, that the doctors operate, that are sometimes in the very same facility as the public clinic. And Dr. Kalman is right. You can't have two separate and unequal levels of treatment for individuals, for patients, based on their ability to pay or based on their insurance. So we find that many of these hospitals will refer patients who are publicly funded or who have no insurance to the hospital outpatient clinic, and then those who have private insurance, who are covered by workers' compensation, get referred to the faculty practice of their other physicians. So you have two levels of discriminatory health care. My bill would rectify that by requiring that the same patient bill of rights that we have at the hospital outpatient clinic, you have to apply at the faculty practice. Because that's how they get away with it, because the same bill of rights does not apply in the physician-sponsored group. And I'll give you a real-life example. A few weeks ago, I got a phone call from an organizer with the Committee of Interns and Residents. They're basically a union for interns and residents at our hospitals. And many of our hospitals in Bronx and in New York City are members of the CIR. But right now, they're organizing the doctors, the interns, and the residents at St. Barnabas Hospital. And through the organizing, they've learned that at the St. Barnabas Hospital emergency room, there's a written memo telling the ER doctors that if a patient comes in with private insurance, workers' comp, or some other level of private payment for their injuries or for their treatment, that it be referred for outpatient services to a faculty practice that's operated and owned by senior St. Barnabas Hospital administrators. So they're taking the privately paid folks and referring them to a different level of care, a level of care that's being provided by the senior doctors at St. Barnabas. And the Medicaid patients, the publicly funded folks, the people who don't have health insurance, are referred to the hospital's outpatient clinic. So we have in writing that this practice exists. And as our attorney said, Ms. Agarwal, it's a violation of the Civil Rights Act, which says that you cannot discriminate based on your source of payment. So if a hospital is receiving federal dollars, state dollars for health care, they cannot then discriminate against the patient who comes in as either uninsured or has Medicaid or other form of public insurance. But they're doing that. By looking to apply the Patient Bill of Rights to these faculty practices, we begin to address that. And what Dr. Kalman also didn't fully state to you is that we've been trying for years to interest the State Attorney General, Andrew Cuomo's office, to investigate these hospitals that have these two levels of care. Because we know and we believe it's a violation of the Civil Rights Act based on source of payment. And one last thing I want to do is just to read you briefly. We've been talking the Patient Bill of Rights, but how many have actually read it and know exactly what it says? I just want to highlight a couple of important things. It says that if you believe you have not been given adequate plans for your medical care and other services that you need before leaving the hospital or leaving your doctor's practice, you have a right to know that. You have a right to know the name and position of the doctor that's seeing you. You have a right to know the names and position of anyone who sees you for your treatment and care. And you also have the right to complain, to report your level of care to the New York State Department of Health, the Office of Professional Medical Conduct. We need to exercise those rights. And once we can begin to have those rights publicly stated and enforced at the private physician practices, we can begin to see our health care begin to improve and have one single system of equal care for each and every one of us, regardless of our source of medical insurance, whether we're uninsured, we have Medicaid, or we have some form of private insurance. That's the only way we can make health care access and health care treatment a reality. We know what happened when we were able to get rid of a separate but unequal system of education. Our children began to do better in school. Many of us were able to graduate from college. Well, we also want to make sure that this generation of kids that are coming into the room will have a long lifespan, can live to be 80, 90, 100 years old with quality health care and not having to lose limbs because of diabetes or having to suffer from cancer or other lately improperly diagnosed illnesses. We want to make sure that our community is taken care of. And I want to thank you all for being here today and getting more information and more knowledge. Thank you.